these messages which can be taken to the public, and this will be helpful for women aging and a better aging. So I once again thank everybody, particularly Hepzibah Madam, Premalada Madam, and one and all here. Thanks to our Honorable Minister for Health who has graced this occasion. Thank you. Thanks for the opportunity.
Thank you, sir, for this insightful, emphatic reiteration on a public health perspective of this natural event of life, menopause, and insisting on the health span beyond menopause in the longevity of women. Thank you once again for that. It's a great pride and honor that we welcome a honorable chief guest, Thiru Dr. K.G. Arun Raj, Minister for Health, Medical Education and Family Welfare, Government of Tamil Nadu. His presence today adds immense value to this gathering and reflects the significance of our collective efforts in advancing healthcare. Dr. Arun Raj's professional journey is a remarkable blend of medicine, public service and visionary leadership. A graduate of the prestigious Madras Medical College, he began his career as a physician, serving communities with dedication and compassion. Motivated by a broader vision of public service, he successfully cleared the civil services examination, joined the Indian Revenue Service, where he held several senior leadership roles before entering public arena. As the Minister of Health, Medical Education and Family Welfare, Dr. Arun Raj brings together the perspectives of a clinician, an experienced administrator and a policymaker. His vision focuses on strengthening public healthcare system, expanding access to quality medical services, promoting excellence in medical education, and ensuring equitable and affordable healthcare for all citizens of our state. His commitment to excellence, integrity, and innovation continues to inspire the medical community and the public of Tamil Nadu. Sir, your presence today greatly enriches this occasion. Your leadership inspires healthcare professionals, educators, researchers, and students as we all work together towards building a healthier and stronger Tamil Nadu. On behalf of the organizers, faculty, delegates, and all the participants, we extend a heartfelt, warmest welcome to you. We are deeply honored by your presence and look forward to your valuable guidance and an inspiring address. We warmly welcome our esteemed chief guest, Honorable Thiru Dr. K.G. Arun Raj.
Respected Dr. Shudha Sharma Madam, President, Indian Menopausal Society, Dr. Premalata Ramachandran Madam, President, Chennai Menopausal Society, and Dr. Deepa Tangamani, Secretary, Chennai Menopausal Society, and all office bearers of Indian Menopausal Society and Chennai Menopausal Society, delegates, senior doctors here, and other distinguished members who have assembled here. It is indeed a great honor and privilege to be one amongst you to address this gathering. I mean, really, I should thank the organizers for inviting me. In fact, this has been an eye-opener for me, as sitting in the position where we could influence the public policy. I think attending this particular conference has been, I should accept that this will be a defining moment in this public health policy of Tamil Nadu. The reason is, I was just wondering, women, we form 50% of the population, and one third of a woman's life is spent in menopausal period. So the amount of importance we give to a pediatric care or some other specialty is not given to women of menopausal age. So I was just asking the President whether we have any national programs addressing these menopausal issues. Like we have national blindness control program like National Leprosy Elimination Program. I was just asking whether do we have any national program specifically for women for this very important issues affecting this perimenopausal women. She said no, and I take this opportunity to say that I will take all possible measures with the guidance of Honorable CM to make Tamil Nadu a pioneer in bringing out a policy, a special program for menopausal women. So, having said this, I like to mention few things on a lighter note. Many logicians are here. I think almost all are logicians here. All are logicians. Most are logicians. Okay. And many are from government service. Being myself a doctor from Madras Medical College, I still remember vividly that when we enter this internship program, this house agentship, this all chiefs and assistant professors, they have a soft corner for male CRRIs. So, you're laughing, that means that is a fact. So, our lady colleagues, they always used to say, see, ningala free up engala mattum pidichu. So we had a very nice time under the loving care of our senior logicians. We all male CRRIs had a very good time. Now, the gynec postings, after completing gynec postings, I thought that I'm giving my own experience. When I entered labor ward, that labor ward postings, I initially thought that I would easily relax but in fact, after medicine internship and surgery internship, OG was my next third internship. And I happened to conduct the first delivery. And the mudal kolande and delivery receive the baby receive that was the moment I felt I became a complete doctor. And so I have a very special relationship and special bonding for this IOG in my alma mater. So, Director of Public Health was saying, generally we medical students tend to ignore that chapters on menopause and all. I think we should make menopause as a compulsory long case for every... Yeah, see, cervical cancer, breast cancer, and the marla, cervical cancer is a long case, ovarian cancer is a long case. Why not? See, every woman is undergoing this menopausal period. So these issues are most prevalent than cervical cancer and ovarian tumor. We should make at least, this is for PG. Yeah, madam is agreeing with me. So at least, if not a long case, it should made a short case for them. Any menopause related issues. See, daily, day in and day out, we see complaints related to this only. See, even when I was working in a primary health center, most women used to come with kaikal kodachal na varanga. See, that awareness is not there. See, we tend to say that they are just because of their own psychological issues they are coming. This awareness that it is due to an organic biological change, that awareness is not there. I think it's time that we reorient our policies towards tackling this very important public health concern. In fact, it is a very public health issue is there. And I was given to understand that by 2030, around 47 million women will enter menopause each year. That is an impact on public health which is not given the due importance. So under the leadership of our Honorable Chief Minister, Sir C. Joseph Vijay, Tamil Nadu will be a pioneer state where we bring a special program on menopause. This is especially because it is the women who have given this regime, and it is the women of this Tamil Nadu, the mothers of Tamil Nadu who have elected this government to this power. and it is our bounden duty to take care of them. I should mention, I have seen my own mother entering this perimenopausal phase and how she has encountered navigated this phase. Many women, they tend to avoid or they tend to suffer in silence because of many reasons, because one is lack of awareness. Then second is because of the social stigma attached to this menopause. And third, because of lack of facilities which caters to their needs. So we should address all these aspects. We should try to, more enlightened women, especially this, even many educated women, they are not aware of this biological changes, because this is just a natural biological milestone in a women's lifespan, and we should bring this awareness to them. And also, we should, as a public health policy maker, it is our duty, the government, it's a duty of the government to have facilities in all, not only in the primary healthcare, but also secondary and tertiary healthcare to tackle this very important public health thing. And I sincerely, that's why I said I must thank you for inviting me to this conference. And I wish that this multiple, and I wish that not only physicians should be there in this conference, even physicians and other doctors of other fields also should be part of this menopausal society, because general physicians, they take much of the load. Not all women with menopausal symptoms come to the gynecologist. Most of them, in fact, come to general physicians. They should also be part of this menopausal society. Okay. Yeah, multidisciplinary approach is required. So, having said this, I congratulate this society for organizing this wonderful conference, and I wish all the success, and I wish that this conference gets the due recognition and importance in years to come. Thank you one and all for giving me this opportunity. Thank you.
Thank you, sir. Another feather will come onto your cap very soon. At this point, I would suggest to the Honorable Minister, it's not only women, but also men. Women, it's more dramatic, it's menopause, but there's a term called andropause, which is very, very common: osteoporosis, cardiovascular risks, sarcopenia, and metabolic disorders. It has both the men and the women in that genre. So I think let us be pioneers from Tamil Nadu, under your guidance and under the Honorable CM, to launch this new platform in the years to come. Thank you very much, sir.
If I can just say a request on behalf of Indian Menopause Society and Chennai Menopause Society, let's give a standing ovation to our minister for his commitment today to launch this national program. All of us are very proud of it, sir. Thank you very much. Thank you.
So thank you, Dr. Arun Raj, for that vision, for that initiative, for that commitment. You know why? Because that has been a very smart and clever move, because by doing this, you are not just taking care of these females, you are taking care of their husbands as well and their family as well, who are the sufferers.
Yeah. On a lighter note, on continuation with the minister's words, menopause is traumatic, but andropause is traumatic. So probably we need to look after both. So it is now time to felicitate our dignitaries.